If your GP or nurse prescriber decides that you need antibiotics, please take them exactly as prescribed.
Please listen to your GP and pharmacist and nurse's advice and only take antibiotics when necessary. Taking antibiotics just in case may seem like a harmless act, but it can have grave consequences for you and your family's health in the future.
People often think that if they have a cough or a cold, that antibiotics are needed, especially if lasting more than a few days. However, that's not the case, as the vast majority of these infections are due to viruses, and they will get better on their own.
The guidelines may recommend a specific antibiotic for a condition or no antibiotic, especially for conditions that settles on its own, like cough, sore throat or earache.
So quite rightly, there is ongoing concern about the rise in antibiotic resistance, and part of helping us to reduce that resistance and make antibiotics being as useful as they've always been is to make sure that we're only giving antibiotics to those who need them, so not if you've got a viral infection.
Antibiotics are now something we do not have the luxury of prescribing just to shorten the course of a disease very slightly, which is going to get better on its own anyway.
The more antibiotics that are used for these minor illnesses, the more harmful bacteria may become resistant to these drugs. This means that in the future, antibiotics may not work when you really need them to.
You may have heard of a condition called sepsis. It's been in the news a lot recently. It's a very severe, indeed life-threatening illness, and unfortunately about 100,000 people per year in the UK are admitted with this condition. 37,000 of those unfortunately die, and the only treatment that is effective is prompt use of antibiotics. So you can see that it is absolutely essential that we have effective antibiotics that we can use for these patients.
Infections related to surgery could double, putting people who need procedures such as heart surgery, hip replacement or caesarean section at risk of dangerous complications. Cancer patients are also much more vulnerable if antibiotics don't work. Both cancer and the treatment we use, called chemotherapy, reduce your ability to fight infections. Antibiotics are critical to both prevent and treat infections for all these patients.
Antibiotic resistance is a problem across the world, and as you all know, it's increasing over time. So about 1.5 years ago, I was faced with a patient who returned from abroad with a resistant infection. What we'd done was the patient had come in, we'd given them the appropriate antibiotics, and then when the patient was tested, we'd found the patient was carrying a bug, a bacteria, resistant to all known antibiotics. I had to make a decision as to what to treat the patient with, and I found it very difficult. All of the usual things we would use, we couldn't use because it was resistant. In the end, we had to give the patient a combination of lots of different drugs with lots of different side effects.
Every day we're faced with scenarios where due to antimicrobial resistance we're running out of antibiotic options, and it's our job to kind of find out what we have in the cupboard to offer patients, but that's becoming more and more challenging, so it is important that antibiotics are used appropriately.
A lot of patients come into hospital, there's quite a big expectations to prescribe and supply antibiotics, and it's about our job is to liaise between prescribers and nursing staff to make sure that we use antibiotics appropriately so we don't drive resistance to help better improve patient care.